Hello, my name is Patrice McLeod, and I'm presenting on delegation and conflict management. So, part one, conflict. This scenario will discuss physician to physician conflict. So, the situation is you are a cardiovascular nurse and you are taking care of a patient with sepsis with a known history of congestive heart failure. The patient's blood pressure is beginning steadily dropping after you've given 2,000 cc's of fluids, and the critical care physician decides that he wants to order an additional 1,000 cc's of fluid to prevent the patient from going in shock. So you also have a cardiologist on the case that wants to, of course, give the patient volume because they're losing, they don't have enough, their blood pressure is dropping, but they also want to be very conservative with that volume because the patient is a CHF patient and they don't want to exacerbate their heart failure. So your role is to how to figure out how to resolve this conflict between both physicians. So in looking at the conflict resolution strategies in our book, we know we have compromising, competing, cooperating and accommodating, smoothing, avoiding, and collaborating. So to begin with, compromising, each party must give up something. In this particular scenario, we know for a fact that the patient needs volume, but maybe we can compromise on how much. So maybe giving a smaller fluid bolus. Next, competing, one party pursues what they want at the expense of the other. In this particular case, this is not the way that we should go. I don't believe there's a way that you can do this in this particular scenario without harming the patient. Next, cooperating or accommodating, where one would make a sacrifice in order for the goal to be established. So in this particular situation, if that were to happen, you would have the one who made the sacrifice kind of looking for like that payback in the end, saying, hey, well, next time, we got to establish for the future, you can't, diurese in this manner for patients with CHF. Maybe you want to decrease the amount and consider that when you have those type of patients that are septic. Next, smoothing. So in this particular strategy, you want to focus on your agreements, create positivity in this negative conflict. And a way to pacify would be to say, hey, we've given a lot of volume. So maybe you should focus on diuresing the patient in the end after they've overcome the sepsis and not went into shock. We can pull some of that fluid back off. Next, avoiding. So not acknowledging the conflict or the person and their beliefs. Again, just like competing, we don't have room for that because time is of the essence with a patient with sepsis, and this type of strategy would not be fit for this scenario. You normally see that in trivial events where those issues can be resolved without, on their own. Lastly, collaborating. This is when you both set aside your original goals and come and create a plan together. This is your win-win scenarios. So in this particular case, negotiation is another strategy you can use to come together for a proper solution to a conflict. If done correctly, negotiation can mimic collaboration, or if done wrong, it can mimic competing. So to do it right, you want to be prepared before, during, and after. So before, of course, the preparation process would be, what am I going to bring to the table that can serve as a negotiation piece between this physician and the next? So I had time to just sit back and think of a plan, a way to incentivize that for both of the physicians and create a starting point. So to give you some back history on how I actually negotiated this situation was we have a new technology piece in our hospital called the EV1000. It's a hemodynamic monitoring device, and it uses small fluid volume boluses at 250 cc's at a time to titrate for the adequate amount of volume in a patient with a decreasing blood pressure, which in this case, the septic patient has a decreasing blood pressure. So my negotiation piece was, hey, we should use this machine, and then using the EV1000, we can give the boluses as you would want, referring to the critical care physician, but we can also be conservative the way the cardiologist wanted to, and do it in small increments and get real-time cardiac output, the cardiodynamic numbers, to know that we aren't over bolusing the patient. So skipping to during the negotiation period, it's very important to keep your composure. You have to know your stuff. And knowing your stuff, you have to be confident and be assertive with what you're asking, and role model that very good communication and professionalism that those two should have been role modeling to themselves in the beginning. And lastly, afterwards, you want to restate what has been agreed upon. So in this case, this whatever you all agree on is an official verbal order. And with any order, you have to call back to the physician what they have given to you to make sure that you heard them correctly. And lastly, we're going to acknowledge and thank them for coming to an agreement. So some wrong ways to handle conflict are destructive techniques. So one being ridicule, that's a form of intimidation that won't end well on either side. Making ambiguous or inappropriate statements or questioning. And that part made me think, well, what if the cardiologist would have made a snide remark to the critical care physician and say, hey, who knew that you knew how to diagnose and treat patients with heart failure and not put them in overload? That would have been condescending, and it would have been counterproductive to what our task was at hand. And then aggressiveness, that's a form of control, and that will cause one or both parties to shut down and essentially avoid, as we know that that is not a good strategy to use when solving conflict. So part two, we're going to focus on delegation. The scenario in this case was that you have a stat order to complete a clean catch urine specimen, and you're actively dealing with a crisis, and the doctor wants this done now. So you decide that you're going to delegate this task to your CNA. So when we're delegating, we need to know the 5 rights of delegation: the right task, the right circumstances, the right person, the right direction and communication, and the right level of supervision. So how that relates to each one of those topics: the right task. So the task at hand, clean catch urine specimen. Check. So that's the right task. We can delegate that task. Right circumstance. In this case, you have a doctor that wants something done now, but you're dealing with a crisis with another patient. So this is a great time for you to be able to delegate that task. Right person. A CNA is the right person to delegate this task to, because they do obtain the skills and abilities to perform a clean catch. Right direction and communication. So the nurse, it is her responsibility to make sure that you are articulating properly what you want done to the CNA. So you have to tell them, hey, we need you to use BZK wipes, and we need you to properly collect this clean catch, and give them the steps and the direction to do it. And lastly, the right level of supervision. The nurse has the autonomy to supervise in this particular situation. So when you're thinking about delegation, you want to be smart, be specific, be measurable, attainable, relevant, and time specific. You want to tell them this is stat, this is now, be very specific and detailed, and the task at hand will be completed correctly. So there are delegation errors, under delegating. That just shows that you have a lack of trust in your peers surrounding you. You often see this with new nurses, especially the concept of, I'm giving you a task that ultimately I'm responsible for, so I might as well do it myself. So they are known to under-delegate. Over-delegating, you see that with some managers. You have some very compassionate and eager nurses that are competent, that get the jobs done correctly every time you ask, and you begin to give them more and more responsibility. That can overburden them and overwork them. So you have to be very careful to have a fine balance. And lastly, improper delegating. You don't want to give the wrong person the wrong task. So you want to make sure that they are skilled and able to complete that task. And also, you don't want to delegate for the wrong reason. We don't want to just delegate tasks just because we don't want to do them. That creates bad practices for you as a nurse. And lastly, part three, we're going to focus on creating a healthy work environment. So what does that mean? According to the American Association of Critical Care Nurses, a healthy work environment entails 6 evidence-based practice standards, with those 6 being authentic leadership, skilled communication, true collaboration, effective decision making, appropriate staffing, and meaningful recognition. So, authentic leadership, you need a great leader to carry forth the mission of your department. Next, skilled communication. Communication is key in all aspects of nursing. You want to prevent medication errors and sentinel events, and if you have a lack of that, that is exactly what would happen. True collaboration, as we've said, is going back to part one. Collaboration is key in healthcare. You need satisfied patients, satisfied nurses, and working together as an interdisciplinary team is what's best for our patients. Effective decision making, having shared governance, nurses having a say in all aspects of hospital decision making is pertinent and very important. It's something that we do at my hospital because we're magnet certified, and that is a criteria. Next, appropriate staffing. The evidence shows that if you're not appropriately staffed, it does decrease the morale, and it also leads to sentinel events with patients as well. You can have the patient to nurse ratio be too elevated where you can't focus on each of your patients adequately, and you begin making mistakes and errors. And lastly, meaningful recognition. You want to be recognized for the great things that you do. It increases and boosts the morale of the staff, and overall it just makes you feel appreciated. So my present work environment is awesome. I do have a very healthy work environment. I work for a wonderful manager who really, really believes in meaningful recognition and supporting the staff and giving us the tools and resources that we need in order to complete our tasks, and also promoting further education. Next, she really does focus on our communication. We have mandatory huddle meetings before and after our shift. We involve the patient in our bedside shift report so that they are aware of what we know about them, and they chime in and are involved in that communication process. And we do make decisions collectively. Like I said, we have shared governance, and we always come together for rules and policies that we create on our unit. So how do you create a healthy working environment? So step one, when reading the Freed um, document, paying attention to award systems. So one of the ways in that document they described were to just implement policies where you did focus on rewarding your staff. I think that boosts morale, and it makes a great place for people to be excited to come to work. Next, providing spaces for mind, body, and spirit. One of the CEOs from the Mega Institute believed that, we spend a lot of time at work. So why not make that conducive, just like it would be for your home? So he provides, organic foods at the workplace. And I thought that was amazing to just incorporate that aspect, thinking about your body and freeing your mind and your spirit are all things that you want to be able to do at your workplace. And lastly, assessing the culture. Does this culture match what you want it to be? Sometimes you have to take a step back as a manager and say, is this the type of environment that I want that is healthy for my staff? So with that, that concludes my presentation. Thank you for listening. And I'm Patrice McLeod. Have a great one.